Well, this is going to be the beginning of Part 2, Therapeutic Communications, under Chapter 4. So let's talk about therapeutic communications. And therapeutic communications is communications we're going to use in the process of helping our patients. It uses verbal and nonverbal communication strategies to encourage the patients to let us know how they feel, what hurts, what doesn't hurt, and describe things to us that may be sensitive in nature. The key that you want to focus in on here is that you need to achieve a positive relationship with the patient. Be honest. Don't go in and be a jerk. Make sure you let the patient know you're there to help them and you're there for them. Factors to consider while you're communicating. Think about the age, body language, the clothing, the culture, educational background, the environment that they're in, eye contact, facial expressions, the gender, posture, voice tempo, and the volume that you utilize with the patients. All these factors can meld together to help you successfully communicate with your patients. One thing, you cannot communicate with all your patients the same way. You're going to have to alter your techniques a bit from patient to patient. So the Shannon-Weaver communication model this is the traditional model that you probably learned about in EMT school. This is where the sender takes a thought and turns it into a message, and then sends the message to the receiver. Then the receiver deciphers or decodes it, and then sends feedback to the sender. But somewhere in the middle, the message, let me go ahead and tell you, somewhere in the middle, the message can get mixed up. So sometimes what you're trying to communicate may not end up getting efficiently communicated to the patient, and then misunderstandings happen. So how does age, cultural, and personal experience factor into this? Well, it shapes how we communicate. It shapes the language that we use, the dialect that we use, and the way that we perceive what is being said. Body language and eye contact are greatly affected by culture. Some cultures, if you're a male, you do not need to make eye contact with the females, and vice versa. In some cultures, if you're male, you do not want to touch a female, and vice versa. So you need to take those things into consideration as well when you're communicating with patients. Tone, pace, and volume of language reflect the mood of the person and perceived importance of the message. So if you go in and you're just talking really fast and like in a hurried manner, the patient may perceive that as you don't care about them, that you just want to get this done. The patients may perceive it as I am a burden, or I am just, I'm not the priority here. And we need to make sure that we make our patients a priority, and we need to make sure that we are treating our patients with the greatest respect we can. So ethnocentrism, this is considering your own cultural values more important than those of others. And it's easy for people to do. However, as an EMS provider, you are making a commitment to help people no matter what their culture is. So while you're on duty, you need to take that to the side, and you need to be open, and you need to do what you have to do to treat those patients with kindness, dignity, and respect. Regardless of what your beliefs are and regardless of what their beliefs are, we're here to do a job, and we're here to treat patients. And we want to treat them the way that we want to be treated, which is with respect and kindness and empathy. So cultural imposition, this is where you're forcing your values onto others, and we're not there to do that. We're here to treat patients, and we're here to follow their wishes, because remember, in medical legal, patients have a right to choose as well, and we're not allowed to really force things upon our patients. So nonverbal communications, this includes body language, and body language is probably, and I've heard this used before, that around 80% of the message comes from our body language. So more than words alone, body language can set the tone. So let's say, for instance, if you've got a patient and you're talking to them and you've got your arms crossed and you're standing over them and you're using a raised tone, they may feel like you're angry. Whereas if you have an open posture and you kneel down at their side and you shake their hand and touch their shoulder and let them know you're there to help them in a calm voice, that's going to send a different message. If you can see here in the picture, the gentleman at the top, he looks happy, but the gentleman below looks down, depressed, or angry. However, both of them could try to give us the same message, but you would kind of get a different meaning from both. So some physical factors: noise, anything that dampens or obscures true meaning of a message, that's the noise. And what we're going to do here, what I do whenever I get on a scene, if there's a lot of noise going on, I try to remove it. Like turn off the TV, turn off the radio. If there's children, try to ask them to go to another room or someone to tend after them. Proxemics, this is the study of space and how distance between people affect communication. So you don't want to be right on top of someone, but you don't want to be on the other side of the room. You need to be in a comfortable distance when you're communicating with the patient so that they know that they are the focus, that you're there to take care of them, and then they can build a little bit of trust in you. And whenever you get that trust, then you can get more information and you can more effectively treat them. So verbal communications, we're going to use questions to gather information that's going to help us determine how best to treat the patient or figure out what's going on with our patients. Now, what we kind of want to do, there's two types of questions. There's open-ended and closed-ended, and there's a time and place for both. But we need to allow for open-ended questions to the patient so that they can explain in their own words what's going on. We don't need to be sharp and just say yes, no, because we will miss something. We need to listen to them. Let them describe to us what happened. Let them describe to us when the pain started or what makes it better, and so on. Sometimes closed-ended questions are appropriate. Like if you use a closed-ended question like, are you in pain? Yes or no? And so on. And however, you should also allow the patient's time to follow up behind it if they want to elaborate. Just don't shut them off, okay? So some communication tools here. We have facilitation. That's where we're going to help the patient kind of talk. Like say if you go to ask the patient to describe their pain, sometimes they'll say, well, it just hurts. Well, you can give them like some cues, because at that point they may forgot different things, like is it a burning pain, is it a sharp pain, and so on. But still, don't put words in their mouth though. Silence, this just a pause to let them reflect. Give them time to think and give them time to talk. Reflection, give them time to reflect upon upon what's going on or what you're asking them, which may require some time, and it may require you to repeat what's going on to them as well. Some empathy, try to let them know that you're there to help them, that you understand that they're in pain, and that you are there because you want to help alleviate the pain or the suffering that they're going to. Clarification, this is where you may need to repeat back what the patient told you so that you have a clear understanding of what is being said. Confrontation, this is where, like if the patient is giving you conflicting information, you may need to go back and confront them with that. But do it in a respectful way. Do not be disrespectful about it. Interpretation, this is where you may need to take a lot of bits and pieces of information and kind of interpret what's going on. Explanation, you may need to explain to the patient procedures or what terms or something means because they may not understand. And then summarizing, you may have to summarize the entire information. Like they give you a lot of information at one time, you may need to summarize it, and you can repeat it back to them and let them say yes, that's right, or wrong. So interviewing techniques. When interviewing a patient, consider using touch to show caring and compassion. Like put your hand on their shoulder or hold their hand like they are, like you see here in the picture as well. Use consciously though and sparingly, and especially like if it's opposite sex, make sure that it is very appropriate, and you want to make sure you avoid the torso, chest, face, and any other areas like that. So some interview techniques to avoid are giving unsolicited advice. We're not Dr. Phil, and we're not there to help them with their mental problems or their family life or anything. Don't just throw it out there at them. Don't ask leading questions. Don't interrupt them, and don't use why questions. And try to avoid speaking in our professional jargon unless they're another professional. If you're picking up a nurse or a doctor or another EMT, paramedic, or medical, professional, then use some, because you want to make them feel comfortable. But if you're picking up someone who has no clue about medical stuff, use layman's terms. So family, friends, and bystanders, they can be very valuable. They may have information about what's going on. The patient may be unable to recall things, and the family, friends, and bystanders can help you, and it may help the patient feel more comfortable. But however, you need to allow the patient to ask you questions, okay, if they're able to, if they want to. And don't be afraid to ask people to give you room or to give you some privacy while you talk to the patients, okay? And sometimes you may have to decide if having family and friends nearby will make the patient more or less anxious. Sometimes it can help, sometimes it can hurt. Take, for instance, like a teenager. A teenager may not want to talk about their sexual activity in front of their parents. So you may need to separate that. So the golden rules. These are practices that help calm and reassure our patients, and they include keep and make eye contact. It makes the patient feel like that you care and that you're paying attention to them. Tell the patients the truth. If it's something's going to hurt, it's going to hurt, okay? And speak slowly, clearly, and distinctly, and speak on their level as well, and be respectful. And if you do these things, you will be successful, and it will help aid you in identifying the things that you need to identify and getting the information that you need to help this patient and provide superior patient care. Well, that does it for therapeutic communications. Our next lessons will be part 3, and I believe this is communicating with difficult patients is next. Thank you.